Hello,
Hi.
I'm Thomas. I'll be your nurse today. Just gonna wash my hands here. It says here we got a physical assessment for you. Got any questions about that? Alright, can you tell me your name and date of birth?
It's Cheyenne, 10/24/91.
Perfect. And can you tell me today's date?
It's October 11th, 2020.
Alright, tell me your president.
Donald Trump,
And do you know where we're at right now?
Madisonville.
Perfect. Okay, so you're well aware of who you are. You're oriented times 3. I'm gonna start with your vital signs. So, pain. If you have any pain recently, 0 to 10, 0 being 9, 10 being the worst.
No, zero pain.
Perfect. I'm gonna check your pulse here on your wrist. I got 82 beats a minute. We're gonna do your blood pressure now. Is there any reason I can't do one arm or the other? Do you have arm you prefer?
I prefer this arm.
Perfect. This will get a little bit tight on your arm. Just relax that arm for me. Alright, we got 120/70. Respirations are 18 breaths a minute. That's really good. There's no labor breathing. Chest will be a 2 to 1 ratio. So perfect there. Let me get some gloves on real quick. We're going to start with your head. Have you had any lesions or anything? Your scalp here. Scalp is white. There's no lesions. Look at your ears over here. External looks good. Okay. Head size and shape is symmetrical and round, no egghead like Adam Sandler or anything. So we're going to look at your eyebrows now and your eyelashes. They look to be purpley distributed. Eyes appear symmetrical. We're going to take a look at your eyes here, just look right your head. Pupils constrict and accommodate well. We're going to go in, follow it in. And then we're going to follow it again. Reverse just your eyes. Perfect. So cranial nerves 3, 4, and 6 appear to be intact. Movement was normal. Let's get your size of your pupils real quick. They are currently a 4. Sclera looks white. Conjunctiva is pink and moist. Pupils are equal rounded to the light. Again, they are symmetrical. Looking at your nose, it looks symmetrical in its midline. Look at your septum here. Mucosa looks good, no signs of drainage or lesions. So now I'm going to go stand behind you and whisper a 2-syllable word. And I want you to cover one ear and repeat it back to me, okay?
Football.
Perfect. Okay, so cranial nerve 8 is intact. Now I'm going to have you smile, frown, put your cheeks for me. Perfect. Cranial nerve 7 is intact. I'm going to look at your oral mucosa here. Get your mouth, see your tongue for me. Tonsils are grade 2. Mucosa is pink on the waist. Teeth look all be intact and good. 32 teeth up in there. Tongue is pink and moist like it should be. Can you wiggle your tongue around for me, up, down, left, and right, and swallow for me? cranial nerves 9, 10, and 12 appear to be intact. Go ahead and shrug your shoulders for me. Cranial nerve 11 appears to be intact. Take your head and just move it all the way around. Range of motion looks good. Perfect. Any pain there?
No.
All right. Lead your trachea here. Swallow for me again. Everything's midline. No JVD or anything noted. We're going to check your carotid pulse real quick. And that is good bilaterally as well. We're going to check your patency of your nostrils now. Just hold one nostril for me. And then smell this. Tell me what you smell. Hold one for you there.
Alcohol.
Alcohol, perfect. We do that bilaterally as well. And that is cranial nerve 1 is intact. Get rid of this. All right. So now we're moving down to the chest. Like I said a minute ago, it's 2-to-1 ratio. I'm going to stand behind you and feel your lungs as they expand. Take a deep breath for us to get back here. Perfect. So the breath felt symmetrical, the lungs felt symmetrical in the inhalation there. While we're on your face here, we're going to assess your sinuses, your frontal sinuses. Just touch your face here. Maxillary. Perfect. I'm going to assess your temporal artery. All right. Well, in there as well, it's a grade 2. So is her carotid and her radial pulse. If I didn't say that a minute ago, they're both grade 2. So now we're going to listen to her lung sounds. Anterior pulse, move here, please. So on the front, we're going to have 5 spaces on each side. I'm going to go down through them. Number 1 is below the clavicle here. And 2, 3, 4, and then 5 a little lower. And the same thing on the other side. Turn your back to the camera here for me. And posterior is going to be 9 on each side. So we're going to start inside the scapula up here. 1, 2, 3, 4, 5, 6, 7, 8, and 9. Make sure you get that lower lung there. So we did that bilaterally as well. So now we're going to do heart sounds, excuse me. So left inside the sternum here, right side of the sternum here, second intercostal space. We're going to have our aortic, and then our pulmonic directly across on the left side, and then down 1 will be Erb's point, and then the tricuspid, and then in the midline, mid-clavicular, fifth intercostal space, be your apical. Listen to that for 1 minute, okay? All right. S1 and S2 sound good. 86 beats a minute. Perfect. Sound heart. That's really good. We're going to look at your arms now. Can you stick them straight up for me? All right. Arms appear to be symmetrical. We're going to do the range of motion of your shoulders now. So just roll them up and forward and back. Any pain there?
No.
All right. No sounds of crepitus in the joints. Range of motion was good. Elbow same way. Up and down. No crepitus there. And the wrist, roll around for me. Any pain there? Alright, good. So range of motion, bilaterally, of course, is going to be well. There's no crepitus noted. Skin here, temperature feels good. Color is appropriate ethnicity. It's dry. We're going to check our turgor now. Perfect, no tinting. We're going to check your fine motor movement. Take your fingers, just tap your thumb for me. And that crossed. Now speed it up. Slow it down. Tempo. Good. Perfect. So fine motor movement appears to be intact. We're going to check your brachial now, pulse. And we're going to locate it right here. Just from the bicep. Press right there. And that'll get it as a 2, it's perfect. Bilaterally, of course. Check your cap refill now on your fingers. You just press there. Less than 3 seconds, also perfect. So your upper joints appear to be good. Joints good. We're going to check your muscle strength now. So just push against me. And now pull back. And now squeeze my hands. Oh, she's a strong one. That's a great 5. Alright. So, moving down now, we're going to assess the abdomen. So you could lay back for me. It's on your way. Abdomen would be flat, no distension, no abdominal pulsations. So now we're going to auscultate. And we're going to start in the right lower, going to right upper, and then around clockwise. We have normal active bowel sounds. That's great. When did you last bowel movement?
This morning.
This morning, perfect. And have you had any urinary changes?
No.
Any difficult with the bowel movement or anything?
No difficulty.
All right. So I'm going to check your hip now. So you just take your leg and move it out for me and back in. Any pain there?
No.
Bilaterally, the same thing. Nothing on the hip there indicates any kind of joint issue. Range of motion was good. I'm going to check your knee now. Just flex up for me and back down. Range of motion good there too. You can hold your ankle here, same thing. Just wiggle for me, back around. Good. Range of motion is perfect. And lower extremities, joints are well. Legs appear to be symmetrical. I'm going to check the cap refill on your toes now. Less than 3 seconds as well. I'm going to locate her posterior tibial pulse now. It's going to be on the inside, just with the ankle here. And we got a 2+. Now we're going to check her dorsalis pedis pulse. Look at the top of the foot. Also 2+ bilaterally. No edema is noted. Have you had any swelling in your lower legs recently?
No.
Perfect. Bottom of the feet appears good. No breaks, no lesions. Toes appear good. No signs of fungus. No odd smells coming off of them, so that's good too. You want to sit back up for me, please? You're welcome. And I'm going to check the strength of her legs now. So I'm going to get down here. I just want you to push against my hands. And then pull. And then raise up with your feet. And then down. Again, she's a strong one. Great 5. Everything appears to be normal. And I believe this concludes my assessment. I'm going to deglove, wash my hands. Do you have any questions for me?
No.
None of that caused you any pain or anything?
No. Everything was fine.
All right. You watching the game tonight?
No.
All right. Well, we're watching the game tonight at the house, so I will document everything that I need to document as far as her pulses. For 2+, most strength was a 5. Heart sounds were normal. Cranial nerves 1 through 12. We didn't assess 5 or 2, but outside of that, they were all normal and intact. And that's all I have for you.
Thank you.
Thank you.